Hi, everyone. We are with, me, Lucy Setyan, the host of the Global Health Leadership Voices of our Oxford podcast. And today I have a very special guest, the original founder who sparked so many ideas from working together several years ago. So, Stephen Ogweno, who is going to tell us a little bit about his scaling journey. How did he actually go about it? Why did he start this company called Lifesten Health and a lot of other interesting things? So, Stephen, what about you introduce maybe a little bit about yourself and tell us how did it came to become Lifesten, what Lifesten is today?
All right, great. Thank you very much, Lucy. Happy to connect again after quite some time, seeing that we actually started working quite early in the journey of Lifestyle. But before all of that, I'll give a quick intro to myself and then jump into how we ended up having Lifestyle. So my name is Ogweno Stephen. I come from Nairobi, Kenya. I I have a background in global health and health innovation as well. And outside of Lifespan, before starting Lifespan, I had been involved in other health ventures, especially in the global health space and especially in the prevention and policy space with the World Health Organization, the Global NCD Alliance, and organizations like that. So Lifestyle Health, what is Lifestyle Health? How did it start? I guess that's the place to start. So, Lifestyle Health, think of Lifestyle Health as your personal health companion that helps you to improve your health and wellness, and that encourages you to maintain healthy lifestyles over the long term. The goal of Lifestyle is to ensure that individuals are able to prevent and control long-term chronic diseases. So diseases like cancer, diabetes, obesity, hypertension, diseases that are caused because individuals adopt unhealthy lifestyle habits like sedentary living, lack of exercise, poor mental health, tobacco and alcohol use, and poor diet. So lifestyle essentially is the platform to help you manage your health and wellness, to help you improve it over the long term, and also to help you diagnose, quickly access health diagnosis from your phone, especially seeing that a lot of individuals rarely go to hospitals for medical checkups. And so they might be having, high blood pressure, chronic stress, and these conditions exacerbate over time without them ever having to get any screening. And so one of the things that Lifespan has done is to help individuals quickly from their mobile phone get access to instant diagnostics via transdermal optical imaging, which is something we'll get into as we move into the conversation. So we started in 2022 when I met my co-founder, Peace Iragua, based in Kigali, Rwanda. And Lifestyle Health is a mix of both personal experience and stories, but also the communal experience and stories. So I was born with childhood obesity. I've lived through uh, being a hypertensive and almost developing diabetes as I grew up. And so I know very well what these chronic diseases does to people. But at the same time, I was very lucky because I had people close to me who really helped me to track and manage and improve my health and wellness. And that structure is really what helped change my health around. But that structure lacks for millions of people across Africa and also across the world. In Africa, the World Health Organization says 3 out of every 5 people are exposed to risk of developing chronic lifestyle diseases because of their health habits. And you work in health, you know that preventive healthcare is the space in health where nobody wants to focus on, and which is often the hardest space to focus on and even to monetize if you're a startup working in that space. So me and Peace, we decided that this big problem is exactly the problem that we wanted to solve, and we wanted to solve it for the global south. So that's Africa and Asia and regions in the global south. And we decided that we'll go through an approach of gamification, leveraging on artificial intelligence, hugely leveraging on partnerships as well to be able to bring a solution that helps individuals get instant health diagnostics and also helps individuals develop health habits and maintain those habits over time. So that's a quick story of the motivation and inspiration behind us starting the Lifesten Health.
Hey, thank you, Stephen. I mean, you guys are a power force in your work. And when we first met, as you were saying, it was early days. We actually met during the accelerator program of the Health Tech Hub Africa, where you did quite a lot of work when you were still kind of in the beginning of the company. Now, if we look at the date now, 2026, it's been 4 years. What are some of the biggest learnings you took away in from acceleration to the process which you're now entering, which is truly scaling the work that you do? What are some of the things which, if you go back in time, you might have probably reconsidered how you did them, or I don't know, any other learnings?
Mm. Yeah, I think one of the biggest learnings that we carry to date and that we've adopted over time is the power of partnerships, especially for us at Lifesten who were focusing on preventive healthcare. What we've built is essentially an ecosystem of partners. So I'll give a quick example of how Lifesten Health works so that this makes sense. So if you're a user and you're using Lifesten Health, you download the app, you sign up, get your details in there, and then you have access to health challenges and health programs that you can engage in, and this focus on physical, mental, and nutritional health. So this could be your steps challenge. Are you tracking your food intake? Are you tracking your mental health? Are you journaling? Are you doing meditation? All managed on the same platform. And then you also have access to joint challenges, which you can do with your friends and your class and your family. Joint step challenges or nutritional challenges or mental wellness challenges and activities like that. Now, every activity that you complete, you earn points. And these points you can redeem for various goods and services. So we had to create an ecosystem where we have real organizations on the ground that where you can go and redeem these points from. So these organizations would include gyms, would include spas, would include nutritionists, would include mental health counselors, would include hospitals. And we have now just over 84 partners that we've signed up across Rwanda and Kenya that can help individuals redeem for these rewards. So we had to think creatively, how do we bring this ecosystem together and bring these partnerships together? And that was one of the first lessons that we had to learn. Because our initial thoughts at the very start was we probably could have done provided all of these different services. But as it turns out, that's not how you grow and that's not how you scale. You can't scale alone and you can't grow alone. And if you leverage on partnerships, you move much faster, you have better impact, you reach much more people. Uh, and I can expand on the partnership as well. When we used to work, we did a very uh, big project, the Kigali Cardiovascular Health Challenge. And you introduced us to Neurologics, which is this huge company that does transdermal optical imaging, which is a complex word for saying you take your phone, you point it at your face, it scans the flow of blood under your skin, gives you in less than a minute your blood pressure, your mental stress index, your cardiovascular disease risk, and like 13 other key health indicators. We couldn't have built that from scratch. So without that connection, for example, we would have missed out on a very huge part of the problem that we are trying to solve, which is, again, helping people have access to early diagnostics and then helping them develop and maintain healthy behavior over the long term. We eventually worked with Neurologics to customize the platform and the data for the African context, which is where we were working in. And that really, that I think is the point where our growth really accelerated after that partnership had been solidified and after we had started to introduce this new innovation on the continent. Essentially, we were the first in sub-Saharan Africa to introduce transdermal optical imaging for the public to use for health diagnosis. We've had research that validated this with the Ministry of Health in Rwanda and with the partners that we worked with from the government that helped to validate this process. But goes back to say that without partnerships, there is no growth. And that was one of our biggest learnings. The other learning that we had, this is 4 years later, is that the focus always has to be on the people whose lives you are looking to change, as opposed to primarily on the technology that you are working on to change their lives, because the technology can change over time. But if you master the problem that the people are facing, and if you have a real knack for their experience, then you can be able to continuously adapt and iterate over time to address that problem. And so we had that, especially in the early years, that very fixated idea on the product as opposed to on the people and solving their challenge. And that is a lesson that we learned quite quickly and started to pivot quite frequently to be able to adjust the solution to actually address the problem that people had, as opposed to adjusting the solution just for the sake of. Lastly, in terms of those key lessons that we learned is, again, when it comes to fundraising, the fact that the process to fundraise, especially for African-led startups, is very much collaborative. We've been able to raise quite a bit of funds, but because we collaborated with each other to address various components of either the grant or the challenge and things like that. Even at the moment, we are going for quite a big grant and we are partnering with organizations in the UK and organizations in Africa and universities, and we are bringing these different components together to be able to be the perfect fit for the donors and also for the potential community that will get to benefit from this. And so, as opposed to the West, where fundraising is really a solo game and a lot of money is flowing in the ecosystem, here we found that it's a bit different. And the way to go about it sustainably is actually to do it via partnerships. And so, those I'd say are some of our top 3 learnings from when we started to now.
Stephen, and thank you so much for saying that. I mean, every founder I speak to tells me probably the same, that of course the problem of the person has to come first, the person for who you're doing everything that you're doing. But it's very interesting that you're spotlighting partnerships, because a natural reaction for some companies is, maybe you'll see on LinkedIn, they put something like, oh, we're in a stealth mode. So they keep it super hidden, close to their chest, or to other founders to say, you know what, they're our competitors, we're not going to go with them. What did you say to guys like that? What would you say to guys that keep their cards close to their chest and prefer to go solo? What are the benefits over, how should I say, benefits of partnering over those two, not partner?
Yeah, you never go far. With your cards close to your chest, you can't see very far across the table. You can only see up to where the cards are, which is very close to your chest. If your cards are more open, then a lot more people in the table are able to see areas in which they could come in to help improve your play, which is, I think, the philosophy that you have to move with, especially when you are approaching your work as a startup that's looking to scale, but that's also looking to benefit the communities that they are working in. And so that analogy is one of the biggest shifts that we had very, very early on, because that's the temptation of every startup. Every startup at the start always wants to keep all their partners only to them and all of their cars only to them, without realizing that if the cars were actually exposed and open, a lot more people who actually have interest and who have actually been looking for you find you. But if you don't open up yourself, then you're never found. And if you're never found, you end up being just in that small environment that you are in, never getting to expand anywhere else. And so for us, that realization that there is a lot of people outside here that would really want to partner with us, that would really want to help us to scale, that would really want us to collaboratively work together, and we just need to make ourselves known to them. That getting ourselves known to them and us opening up to partnerships all the time is how we've been able to scale quite quickly. And it's always not about money. In fact, a lot of successful partnerships never involve monies crossing paths, as we've seen with our partners. We have 60 partners, almost 80 partners with the rewards, who give rewards. We are never exchanging money, but they bring us new clients. We give them new clients. There is a community that they create on our platform for their clients who are using Lifesten. They recommend other people to come using Lifesten. So new people to Lifesten get to them because of the rewards that they redeem. Their clients and their markets come to us because of the community that we provide and the discipline on the platform as well. And so that continues to become a win-win relationship where money is not even exchanging hands, yet both of the organizations involved continues to grow.
And this is even more true now that we know that USAID has, cut quite a lot of the funding. A lot of big organizations have cut funding, which is more, how should I say, public type of funding, which speaks about the need to have new business models, which are based on these partnerships, like you just explained. And that's a very successful model, your model, in which everybody wins from being partners with each other in your particular case. Now, what are some of the prerequisites for a partnership to be successful in the long term? Let's say you are excited to partner with someone, you clearly see the value of both of you partnering, but what would make a partnership successful? Can you give some kind of examples from just your lived experience or what you've seen maybe also between other startups working with other younger organizations?
I think what makes or breaks partnerships, and especially if you want to have a successful partnership in the long term, and with our use case as Lifesten, is three things. One is that at the core, you all have to be aligned towards the greater good. So for us, is improving people's health. So the partnerships that we pursue are also from individuals who are working towards improving their clients' health, whether it's nutritionists, whether it's the gyms, whether it's the hotels, and etc, etc, etc. So there has to be that win-win scenario from the onset, that we will bring this to the table, and this is how you will win, and you will bring this to the table, and this is how we will win. So that broad vision is one of the things that makes or breaks partnerships. I think the second thing is really in some ways the simplicity of the partnerships, in the way that there isn't a lot of bureaucracy involved, and that the terms of engagement are very clear. Because a lot of bureaucracy slows down a lot of work and then begins to hinder a lot of progress, and in the end, nothing eventually never gets to be produced, especially in this very fast moving ecosystem. We have to lessen the bureaucracy, especially in the partnerships that we pursue. And that for us, even with the government, when we partnered with the government in Rwanda, we were so happy at how smooth the partnership was, and there wasn't a lot of bottlenecks or hindrance that would be the typical experience if you're partnering with such a high level organization, because the terms and the rules of engagement were quite clear and everybody sort of agreed to that. So that bureaucracy simplification, I think, is the second part to the partnership that makes it successful. And the third is going back to this vision and the goal that you are all aiming to achieve, is really an emphasis on that. Like, this is what we are looking at achieving in terms of goals, and this is how we are looking to approach it. And everybody's interest again is covered in those, because without that end-term goal of what you are looking at accomplishing, it begins to have gray areas, which is what you normally don't want in partnerships that we are engaging with. And so those have been the three key engagements for us that we've worked with through our partners that we've engaged with, that has enabled us to have a quite successful relationships with the partners that we had. Almost all of our partners that we started with in 22, we still have them to date. And that shows, the success that we've had with them in working together to improve the goal. So, yeah.
Talk to me a little bit about negotiation power. Does partnerships decrease or increase negotiation power towards maybe, I don't know, larger organizations? Do you see any change there?
So I'll approach that in two ways. One is that when you're working with bigger organizations, we worked with you and Novartis back then, and we've worked with the governments. How we were able to partner to do that work was because the way we were actually able to do it quite successfully, again, was because the terms were quite clear, and we negotiated the terms. So you came with, or the large partners come with their suggestions, and we also come with our suggestions, and then we agree on, what's the third suggestion that covers all of the participating organizations' interest. So that's the first part to negotiation, that you have to, it's always not what I want versus what you want, it's what we want, and the we in these conversations comes only after that negotiation piece is done. The second part to this is, if, and I'll use our case as well, is us as Lifesten, with all of our many partners that we have a better stance when negotiating with another huge partner outside of our ecosystem. Say we are all going for the same grant, or we are going for a big proposal or a project or a tender that's out there. We have a larger voice because of the how many partners we have working with us as well. So that's the second part to negotiating, is that the more partners you have, the larger your negotiating power is, and the more likelihood of success you're able to have, especially when going for these different projects, grants, or even partnerships that you are looking to engage in.
Thank you so much for that. Now you're entering in your scaling trajectory. And obviously, you're a Synergia member. And for those of you who have not heard of Synergia so far, that's the partnership infrastructure for startups and scale ups in health and sustainability. Now, Stephen, you are entering your scaling journey. If you can envision a perfect partner or partners, multiple startups or scale ups companies as innovative or as you are, who would be the perfect ideal partner for you, and what would you guys be working on together? If you can just like dream of it, who would that or what kind of organization would that be?
So I'll give three examples of what our ideal partners, especially at this scale up stage, would look like. One would be an ecosystem partner. So this is a partner that is well known within an ecosystem, say within a country or within a region, and that has quite some influence on the ground, and that we're able to work with to bring Lifesten to more people across their ecosystem. So these types of partners, we are actually actively looking for them. So this could be clinical chains or pharmaceutical chains or big NGOs or funders or community-based organizations, or organizations like those. Ecosystem partners who are able to introduce us to new markets, who are able to introduce us to new clients, who are able to work with us to get to new audiences, is the first types of partners that we are looking at. The second type of partners that we are looking at is we are always looking at reward partners. So these would be organizations that offer any health and wellness service that we could essentially use to incentivize our users to continuously engage in healthier behavior, but also that we could get our users to then move into these new businesses or introducing these new businesses to new customers. So these run all the way from fashion and beauty to fitness to nutrition to mental health to hotels to spas to even supermarket chains that sell health and wellness products or have organic products as well. So these reward partners, and they could either be physical or digital as well. So physical companies like we have in Rwanda and Kenya, and also digital as well, online stores and Amazon and things like that. And these are people that would really help our users get incentivized, but Lifesten would also help them access new users and new communities from our existing user base. So we are always looking for these types of partners as well. Lastly is the large funding and research partners. So this could be literally the donors, the NGOs, the foundations, the family offices, but at the same time, universities and researchers and research institutes. So we are constantly working with these types of partners to improve on Lifesten's evidence from research and academic standpoint, to improve on the efficiency and to improve the use case, especially because we are in the health space. But at the same time, we are looking for these partners, of course, to fund the scale-up activities of Lifesten Health, so that we're able to reach more people, create more impact, and also potentially return profit back to them as investors or ventures that are investing in us. So those three categories, if anyone listening falls in those categories, we are on Synergia now, and they could go in there and shoot us a hi. We are waiting for you over there. So yeah.
Thank you, Stephen. And maybe a last question. In which geographies are you looking to scale now beyond Rwanda and Kenya? Just for the audience who is maybe listening, and maybe there are people who really die to test your app and be part of your community. Where are you looking to expand to?
So Lifesten currently operates in 81 countries. So we have
81. Wow.
Yes. So we have active users across 81 countries. And this is not active downloads, it's active users, people who use on a weekly basis, which is how we define active users across 81 countries. We currently have potential partnerships at Imperial, and we're looking to use that to expand into the UK market. But more broadly, we're expanding into the sub-Saharan African market. So this would be uh, East African countries, but also South Africa, as well as Nigeria as potential next markets with reward partners as well. And we're also looking at the Middle East. In fact, we in February were in Qatar looking at some potential avenues for expansion on those sides. So we are very much looking at expanding across the sub-Saharan markets, but also across the Middle East, and with very early entry into the UK markets via our institutional partners over there.
Brilliant. So a lot coming in the next months for you. Thank you for making time to join this conversation today. And probably the next time we'll meet, you'll be already in 150 plus countries. So let's stay tuned. And of course, if anyone wants to reach out to Stephen, he's on Synergia. So thanks, Stephen, for joining, and wishing you a great day.
Thank you very much, and looking forward to connecting.